Hi everyone. We are so happy today to congratulate our authors with first 2026 Editor's Choice Cephalalgia article. Dr. Simona Sacco identifies this article as first one of Editor's Choice. Congratulations. And let me give the floor to the wonderful authors here. Please introduce yourself. Let's start, please, Dr. Ettore Brenna.
Hi, Nina. Thank you. First of all, I would like to say that we are truly honored that our paper was selected as an editor choice in Cephalalgia, and it's been, of course, a great recognition for the work of the whole team. So my name is Ettore Brenna. I'm originally from Italy, and I hold a master's degree in biostatistics from University of Milano Bicocca. I started my career as a biostatistician at a research institute of Axologico in Milan, and then I moved to Helsinki to work at the Institute for Molecular Medicine in Finland. And I currently work as a clinical statistical analyst at Eli Lilly in Cork, based in Ireland. And before we start, I would just like to add a brief statutory note. So these are my personal views based on the work that I conducted during my time collaborating with FIM and during the execution of this research. And this doesn't represent any official position of my current employer. Thank you.
Thank you. Thank you so much. And please, Dr. Marja Liisa Sumelahti.
Oh, yes, this is a great honor. We are really pleased to experience this possibility to, first of all, to be part of the interview, and also it was a great thing to hear that our article was selected as editor's choice in January. I'm a neurologist. I'm a docent at the University of Tampere here in Finland, and I've been working with migraine patients for more than 20 years at the moment. And this work, of course, being a genetic work and also of clinical significance, has been one of the highlights of my last year, I have to say, and this year, of course. I have no disclosures for my part.
Thank you so much. And could you please let us know what brought you to this amazing topic?
Well, we have a precision medicine for migraine attack, the triptan group, but unfortunately, part of the patients either don't tolerate it or don't get a response. And that's why we wanted to combine a question: what is the amount of patients who need a switch to another triptan? And also, is there a specific or certain genetic profile that could help us to depict the population that either gets a response or does not get a response?
Yes, that is extremely important topic in all of us in our clinical life, and of course, very mind-stimulating question. How did you approach it? What was the methodology?
Yeah, so I can start. So this study was initially conducted within the FinGen project, which is basically a large public and private research initiative that combines basically genome data from Finnish biobanks with nationwide longitudinal health registry data. So FinGen basically includes then genetics and health data for more than 500,000 participants. And that's the case strength. So the possibility to link genetic information with years of real-world clinical data, including like diagnosis, procedures, medication usage, and also socioeconomic information. So basically, our goal was to investigate whether clinical and or genetic factors were associated with this non-optimal response to triptan treatment in patients that experience migraine. And then our study aims were basically to describe the characteristics of these patients that have this non-optimal treatment response and then to identify the clinical factors that are associated with it, and to explore also the genetics association that might contribute to variability in the treatment response.
Excellent.
Yeah,
Please.
so basically we started to identify migraine patients who were consistent triptan users, and we used data from the Kila National Drug Purchase Registers to characterize the treatment patterns. And based on this prescription data, we were able to categorize the patients according to the treatment switching. So we did 4 groups, the no switching groups, so the patients who were consistently used the same triptans from the beginning, the switching to 1 triptan, to 2 triptans, or to 3 or more triptans. And basically, as a statistical approach point of view, for each of these outcomes, we performed a high throughput association screening to best evaluate between the large number of potential clinical risk factors. Using, of course, regression-based models with adjustments for covariates and for multiple testing controlling. The genetic analysis were then performed, where we conducted genome-wide association studies, comparing basically the patients with non-optimal theta response who did not switch the treatment, and comparing them with patients who actually switch. So to test the association between these groups, and to see if there are some SNPs that could maybe be highlighted, so that can have a cause to this triptan switching.
Excellent. And what were the results?
Yeah,
Okay.
so basically, yeah, you can go ahead, Marja Liisa. Thank you.
Thank you. Well, first of all, we found out that 85% of patients did not switch triptan medication. The rest of the 9% switched once, and 3 switched twice or 3 times. And we really found some strong associations, clinical features that were associated with the switching. And one of the most surprising finding was that switchers were significantly younger, average 35, 37-year-old, than the non-switchers. That was one of the first notions we made there. And then in both groups, we found that certain comorbidities, pain symptoms, for example, fibromyalgia, was strongly associated with switching triptan, and those who went up to 3 times in switching, they also showed a variety of problems, including endometriosis, which is a very known painful syndrome, and we know that endometriosis patients suffer from the most worst migraines as well. And then there were surprising other comorbidities like intestinal disorders, enterocolitis, dyspepsia, and also oral cavity disorders, gastroesophageal reflux. And from medication use side, previous beta blocker use was associated, and that was in a way expected, because it's one of the most often used preventive migraine medication also in Finland.
This is very interesting. And you mentioned that you look maybe at other factors as genetics and social economic factors. Was there any correlation with changing in medications and those?
Yeah, so we didn't find any genetic or socioeconomic association. Particularly with genetic analysis, it might be due to the limit sample size that we had, because the GWAS analysis needs a higher sample size to actually perform better. And basically, that's one of basically our pain point of this study. So for sure, further studies in larger cohorts will be important to, better investigate the potential role of genetic factors in this triptan response.
That is extremely important information and just really highlights importance of continue looking for biomarkers, but also paying so much attention to comorbidities. How would you approach with this data about age of the patients and comorbidities in your clinic, just as a point for our listeners, for Dr. Sumelahti as clinician?
Yes, I think it's very important for us when we start the treatment plan to consider patient's age. What could affect the treatment adherence in this special group? What are the personal or individual gaps that might cause the switching pattern, especially in this group? And I think it's very important to consider the shared decision making, what they really want, what they expect, and be realistic with the expectations. The goal for migraine treatment is pain freedom at 2 hours, up to 24 hours. It's very important to start with that. And also look at the comorbidities. You know, we are all specialists and we have a tendency to be a little bit narrow-minded sometimes, but it's very important to consider the patient's situation as a whole and really consider these comorbidities, particularly in this younger population.
Thank you so much for really bringing up to our audience attention. I'm sure it will help a lot of people living with migraine. And what is the next hope for our patients? Are you going to the next research or to the next wonderful publication in your mind? Are there any next steps for you in your wonderful research work?
I think Ettore could maybe answer to this one, please.
Yeah, so indeed, this research highlighted the need to better characterize these patients who needs a different type of medication because those patients are actually not responding well to treatments. So I think it's essential for the future research to address these clinical questions. So to identify these particular patients who cannot respond better to treatments and that might need to have a better outcomes with the new generation migraine medications such as triptans and ditans. So that's surely one of the future research.
That is excellent statement. I am sure many of our readers and our audience will think how about other medications. So we really great information of switching of triptans and outlining next steps for us as headache community. Thank you again for this amazing research and publication. We really grateful and we hope that you will choose our Journal of Cephalalgia for your next article and congratulations. Thank you so much.
Thank you.
Thank you so much. Looking forward to it.